So I wanted to talk to you today. With MS, we have a lot of changes in our brain, and the question is, well, what do I do about that, right? And so I'm going to talk to you about some things that you can do that can help your brain integrity, your brain health. I'll also sort of introduce the concept of some of the other talks that we're going to listen to today. There we go. So the objectives, number one, how many people actually feel like they really thoroughly know what a neuropsychologist is? I got 2. Okay, cool. So I'm going to tell you what I am and what I do and how I came to be a neuropsychologist, because most people actually don't have any idea we exist. So that's the first objective. The second is we'll talk a little bit about the neurologic and neuropsychologic effects of multiple sclerosis. Some of these will also apply to other demyelinating diseases that some of the audience members may have. And then we'll talk about some specific strategies that you can use to boost your everyday functioning, right? The big picture is, sure, I've got these limitations, but how do I work around them? How do I live life to its fullest? So, what is a neuropsychologist? These are neuropsychologists, okay. So this is my team here at OSU. We've actually just hired a 4th person, Gwyn, who's going to be joining us. We're very excited about that. But how did we become neuropsychologists? So, believe it or not, we actually go to school for just as long as physicians. It's a long time. But what we do is we learn about brain behavior relationships. So we are psychologists with neuropsychological specialization. The requirements include getting a doctoral degree in psychology. We do clinical placements throughout our education, so it's not just classes, it's not just books. We're in the clinics learning how to help people. And then we do a 2-year postdoctoral fellowship in neuropsychology specifically. So that's a full-time clinical position. I did mine at University of Michigan. I didn't say that. Sorry. I don't do sports, right? I'm neutral. But yeah, so we work for 2 years embedded entirely in a clinic under direct supervision from our mentors to learn how to do what we do. So it takes a while. So what do we do? What our job is to formally assess cognition. So cognition is thinking abilities, like your ability to remember things or pay attention. And we do that mostly through paper and pencil testing. So for example, I may ask you to draw a clock. How many of you have had to draw a clock in your doctor's office? Oh, not too many. Good. I can still do it. So we often will ask you, hey, draw me a clock. It sounds really simple, but for some people they start thinking, wait, which hand's the minute hand and which one's the hour hand? Or what direction do the numbers go? And it's a good way for us to really easily figure out if there's something going on. We may also ask you to name some objects. So for example, this guy right here. These are not our tests, by the way. This is clip art, just so we're clear. So we'll ask you to name some objects. We may also ask you to solve some puzzles, do some mazes, those kinds of things. And so we're trying to sort of poke and prod and figure out how is your thinking. The other big piece of the evaluation is the interview. So we want to get some context, right? What if you're someone who always struggled with reading when you were in school? That matters, right? So I want to make sure I give a good interpretation that's fair. I'm also going to review your medical records. So we look at brain imaging, we look at lab results, other kinds of medical illnesses. Let's say the person has a traumatic brain injury in their history. That's going to be relevant potentially. The way we interpret the results is we look at the scores that we got from the patients and we compare them to people in their age range. So that's really important, right? Because you may have noticed as we get a little older, a little change happens with our thinking, right? I've heard nurses, for example, who are in their 50s and they say, gosh, these new nurses in their 20s are so fast. They just do things in circles. They're so quick. So there's a little bit of change as we age that's normal. We want to get a sense of if the changes people are experiencing are normal or if they're maybe more than we would expect. And that's where the normative data comes in. So these tests have been administered to thousands of other people, so we have a sense of what's normal and what's not. The last piece is we write a report that details the person's history, what we talked about in the interview. It talks about their medical history, what their test results look like, and what they can do about the test results. So it's one thing to say, oh, you really did terribly on the memory tests. What do I do about that, right? So that's the big piece where we have lots of recommendations spelled out pretty clearly, and then we do feedback appointments where we can talk about what do the results look like, what can we do about these results. So we don't just leave you hanging. That's an important message. All right, so we're going to look at what your cognitive strengths and weaknesses are. Sometimes when we know what our weaknesses are, we can kind of work around them, and then we can focus a little bit more on our strengths. This is no different than when you guys were in school trying to figure out what you wanted to do for a living, right? So, for example, I'm spatially impaired exceptionally. I can't find my way out of a paper bag. I would not become an engineer. That would be a very poor fit for me, right? So it's the same concept, it just applies to day-to-day instead. All right, so recommendations may relate to things like treatment of reversible risk factors. These are things like if there's a lot of emotional distress, if we treat that distress, a lot of times people feel like they can focus a little bit better. Or if they're having sleep problems, that's the same kind of thing where we can treat the sleep disorder or sleep problems and they may feel just a little bit sharper. We may talk to them about compensatory strategies, and that'll be part of the focus of my talk today is what are compensatory strategies and how can they help? And then sometimes we can assist with pursuit of accommodations. So I've had individuals come in, they're bright, they're capable, but let's say their thinking speed is slowed down as a result of MS. They can do a really good job at their work, but they're slower than they used to be. I can objectively identify that limitation, put that in writing and say, you know what, let's consider talking about work accommodations. You can go to Human Resources, share this report with them if you want, and identify, can we do something about this? Can I just get a little bit of an extension on certain tasks? Or can I do certain parts and then other people finish it up? So how do I, how can I still do my job? I do a great job, but what kind of accommodations might help me do an even better job, considering I have this medical disorder? One quick caveat, we actually evaluate people for all kinds of problems with their thinking that may be due to various different medical disorders. So we know lots about MS and demyelinating diseases. We also see people for a lot of other conditions. So let's transition. We'll talk about the neuropsychology of multiple sclerosis. So cognitive changes are actually fairly common with multiple sclerosis. They occur in about 40 to 65% of people. The good news is that means the other 50% don't have cognitive problems, so we're talking about a portion of people, not everybody, which is important. The domains that are typically affected, one is processing speed. This is the number one. So this is how quickly you think. People may notice over time as the disease progresses, they still think fine, it just takes them longer to do so. It may be a little bit more difficult to pay attention or concentrate. And then aspects of memory can change as a result. Sometimes, depending on the disease itself, there can be changes in other thinking abilities. For example, coming up with words. People may say, I know the words, but I can't think the words when I'm in conversation. Other skills that can change can be things like planning or decision making. And what's interesting is that the severity of the changes really varies person to person. Some people have no changes. Some people have very, very mild changes, and other people have really quite significant changes in their thinking ability. And you may have even noticed as you've met other people with this condition, the condition is incredibly variable person to person. It's no different with cognition than it is with the other symptoms. So I liked this. It says, not only is my short-term memory horrible, but so is my short-term memory. So yeah, this is the thing. It's pretty common. And frankly, the other thing to say is for all the caregivers out there, some of this stuff may ring true for you too. It has nothing to do with MS sometimes. But the good news is compensatory strategies help for all of us. So we'll talk about that. So very, very briefly to talk about the brain changes that happen in demyelinating diseases. What happens, and most of you probably are more of experts on this than I even am, but we have a dysregulation in the immune system. It's going to preferentially attack what's called myelin in the brain. So I've got this picture here. What you can see, this is a brain cell. This is obviously not what they look like. It's a cartoon. But what you have is you have a cell body, and all these little branches that come off, those connect to other cells. And then you've got this real long, what's called an axon that connects this guy to another brain cell. And you see this pinkish purple stuff. It's not that color. What that is fat. But what it does is it insulates. Anybody who knows electricity, for example, if you can insulate, the message goes faster. If we lose that myelin, the message goes slower. And that's why processing speed is one of the first things that gets hit. The good news is, despite the changes that can happen in the brain, and they can be progressive over time, life expectancy, as you know, is normal. There's no change there. This is a schematic I found online. It's not anybody's brain I've ever seen, but it illustrates the point. So once these changes in the myelin happen over time, eventually it can start to accumulate, and you can see changes in the brain. So for anybody who's ever seen their MRI, this is where your eyeballs will be, right? This is the back of your head. These holes are normal. They're called your ventricles. You want them there because they help to keep the pressure in the brain and it's called normal, as well as take out toxins from the brain that are normal. This side, though, what you can see is there's all this white, and the white is different. So those are changes in the white matter that have developed over time or accumulated over time. So this is sort of an illustration. It's apparently not for diagnostic use, just so you know, but illustrates the point. So as far as what predicts the severity of the brain changes, it depends in part on what type of MS people have. Most people have relapsing remitting. Some of them do have secondary progressive or these other types that can have a different course. So with relapsing remitting, you may have a disease reoccurrence, but then you tend to recover at least to some extent. With some of these others, you may just get progressive disease burden. Most people who have relapsing remitting can stay that way, but they can also convert to secondary progressive where you're not remitting after the relapses, where it just continues to get worse. This is particularly true if you don't treat the disease, but of course talk to your doctor, so this isn't patient specific. Demographic factors can also affect the severity. So for example, women are more likely to have MS, but men can have more aggressive MS than women. These are trends, not patient to patient, but this is a general finding that happens. There are also environmental exposures to things like cigarette smoking or low vitamin D. Your doctors may have talked to you about this already. That can also be related to exacerbation in MS symptoms. So there's other things that don't help, right? So fatigue is, I'm sure you all are very familiar with, is one of the most common symptoms of MS. Fatigue makes it harder to concentrate, right? So if anybody in this room who's ever felt really, really tired, like they just didn't sleep really well last night, they just don't always feel 100%. They're not on the ball. If you're experiencing fatigue every day, it's going to be a little bit harder sometimes to feel like you can really engage in your environment. Sleep disturbance is another big one, and this is irrespective of having MS or not. If we're having dysregulated sleep, we are more prone to having trouble just engaging, being really present in the moment, which makes it hard to remember. Depression and anxiety is another big one. So about 50% of people with MS wind up developing depression or anxiety. It's a very common set of symptoms. And then certain medications can also affect thinking. I gave an example here. Obviously, it's important to talk to your doctors about what medications you really need. You have to weigh the pros and cons of the risks and the benefits to determine. Sometimes it's absolutely worth taking a medication that might make you a little fuzzy. Other times it might not be, and it's worth having that open dialogue with your physician. All right, so I just talked about a lot of depressing things, but what can we do about this, right? So treatment recommendations. So despite the bad, there's also good. Number one, the brain is remarkably resilient. So I have seen people who have pretty substantial changes in their brain and their thinking's normal, which is fabulous. It doesn't always happen that way, but it can. So the brain is capable of adapting to some extent and work around some of these issues. We also know there's a number of different treatments for MS at this point, and there's still lots of research, including happening right here at OSU, on what kinds of treatments are going to be most effective or best tolerated. And most people, unfortunately, but fortunately in some sense, a lot of us have untreated risk factors that haven't been addressed that we could address and maybe help you function a little bit better or feel just a little bit more whole. And finally, we can use those compensatory strategies that I've alluded to, I'm going to finally get to, that will help our day-to-day functioning. So number one, obviously, as far as treatment recommendations, you want to treat the disease as long as that's what's supported by your treating physician. And then address those risk factors. So this is where I'm going to give you sort of a prelude to some of the other talks that are going to happen today. So one is adhering to sleep hygiene techniques. How many of you have heard of sleep hygiene? Oh, good. That's a good number. It's kind of a weird word. It's basically doing all those things that mom told you to do, put your pajamas on, brush your teeth, have a bedtime, wake up at the same time, consistency. Dr. Block will talk to you more about those things. Some of those can help us actually sleep better, even if we thought, well, I'm a grown-up. I don't have to do those things anymore. It's not always the case. Managing mood and stress is another really big one. Sometimes we've been stressed for so long it feels normal, but that doesn't mean it's not treatable or it can't change. And Marjorie Scott's going to talk to you a little bit about this topic. Staying mentally active is helpful. I'm not talking about paying companies to give you quizzes. I'm talking about doing puzzles, spending time with friends, doing things that are intellectually stimulating or enjoyable. So it doesn't have to be like the commercial products that are out there. Anything that keeps your mind thinking is going to be really helpful for you. And then pursuing health-promoting behaviors. So everyone's always asking me, what's the magic bullet to keeping my brain healthy? And it's this really complicated diagram. So unfortunately, there is no magic bullet, but what we know is what's good for our body is good for our brain. So you can see up here there's a bicycle, there's a tennis racket. You don't have to do sports specifically, but being physically active is important. There's some trees. Going out in nature, they call it forest bathing. It's kind of a bizarre term, but being in nature can be relaxing for a lot of people, and it can also encourage some exercise. You've also got some dietary things here, right? So eating fruits and vegetables, meditation, or other stress relievers. There's all kinds of things that can help keep your brain as healthy as possible. All right, so the alluded compensatory strategies. The idea behind there is you want to work with what you've got. So let's say you're a little forgetful, but you're really good at lots of other things. How do you harness that so that you can function the best you can? So if you're having trouble with your attention span, for example, things you can do, number one is try not to multitask. Us women are particularly guilty of that, right? Because we say, the literature says we're the best at it compared to men. That's true unless you're actually having problems, right? So when you divide your attention, you're only as good as how divided that attention is. You're more likely to make mistakes. You're more likely to get off task. You may forget what you were working on even. So trying to do one thing at a time can really help if you're having attention problems. You want to minimize distractions. Some of us are totally fine. We can be interrupted 14 times and it's not a problem. But if you're having trouble with your attention, that's probably not going to be helpful. How many of you have heard of white noise? White noise machines, for example? Good. So there's lots of different ways to make white noise. There are machines that you can buy. You can just turn on a fan. For some of us, we like to listen to music when we work or when we're doing activities around the house. Just make sure it's music that's not going to interrupt your thinking process. So I will say, I try not to listen to new music where I don't know the lyrics because I might get distracted by the lyrics and say, like, what is this song about, right? So having something in the background that sort of drowns out other noises. And then another one is taking brief, frequent breaks, but remembering to actually get back onto the task. So if you're someone who gets distracted easily and you'll get off task, one thing you can do, for example, is set an alarm. So I'm going to take a 5-minute break. I'm going to go to the restroom or go take care of something. When that alarm goes off, it's going to remind me, oh yeah, that's what I was working on, so that you can get back on task. All right, as far as memory, how many of you like sticky notes? Okay. How many of you think I like sticky notes? Okay. So it depends, right? I'm a psychologist. That's my answer for everything. Sticky notes can be really good, but my rule about them is I use them for about 24 hours. If I need to remember something longer than that, I'm going to put it in a notebook. Because the notebook, I'm not going to lose. The sticky notes I might lose, because eventually you get this wall that's just completely plastered, right, which isn't terribly helpful. So there's some other strategies you can use as well. One of the big ones is whenever I go to appointments, I bring a notepad. I'm a paper and pencil person. I'm not terribly technologically advanced. If you are, cell phone applications, there's all kinds that are super helpful. For example, the notepad application. The big thing here is make sure that you label and date the entries so that you can find them, right? Because it doesn't do you any good to write down notes if you can't find them. Other things that can help are using a planner or using the calendar in your cell phone. You can set reminder alarms that can also be helpful. When I start the laundry, I forget I'm doing laundry every single time. So I have to set the alarm so that it goes off and then I say, oh yeah, I'm doing laundry, and I can advance the load. So these strategies are helpful for everybody. There also may be a handout in your packet that has a lot of this information in it, just as an FYI. Taking notes, obviously, believe it or not, the act of taking notes actually helps you encode information, even if you don't look at your notes again. And then writing to-do lists and marking things complete when you've done them. right? So it's one thing to write it down and never look at it again, but it's another thing to really actively use that list. And when most of the items are marked off, you can always start another one. There's a number of memory strategies you can use. Some of these will be familiar, some may not be, and I'm running low on time, so I'm going to kind of push through this. But for example, chunking. So remembering 7 digits in a row can be challenging, but if you chunk it into like a phone number where it's 3 digits and then 4 digits, that makes it easier to remember. Linking things to information you've already learned can be helpful to help you remember things. Using mnemonics. How many remember, please excuse my dear Aunt Sally, right? They now call it PEMDAS. Somehow that's easier to remember for kids. I don't know. But mnemonics can be helpful to, let's say you need to remember what your medications are. You could come up with an acronym that's goofy, but that you can remember, and that'll help you remember each one of those drugs that you're taking. Or just keep a list in your pocket, right? That's easy too. Making up a story to remember the details of something, and then rehearsing, right? So if someone tells me a phone number and I can't write it down, I have to say it over and over and over until I get it onto paper. So these are just some simple strategies that you can implement. Now, executive functions, before I go into how to compensate for them, we have to make sure we know what they are. So executive functions are things that a CEO does, right? Supposedly they get paid the big bucks for this, right? So they plan, they problem solve, they delegate, and I've got this little pros and cons guy. I don't know if you can actually see my pictures because there's that banner right there. I apologize for that. But strategies you can use to keep yourself organized and able to make decisions. One is break large tasks into smaller pieces. That makes them first less formidable or less scary, but also maybe a bit easier to manage. Stick to familiar tasks, so things where you're not having to constantly problem solve and figure out what the issue is. Plan ahead. This sounds easier than is done a lot of times, but if you stop and take a minute to really get a plan first, it may be easier to do what you're trying to get done. And then making a list of pros and cons can also help you figure out, how long is the list of the pros, how long are the cons, how are they weighted, how does that help me figure out what I want to do. So final suggestions: pace yourself, take your time, manage your expectations, ask for help. There's no shame in asking for help if you need it. If I can't think of a word for whatever reason, I'll start describing it and ask someone, like, help me, what is this word? Talking to your doctor can be helpful. Let them know you're having some of these symptoms if you are, whether you're a patient or a caregiver in this audience. If you notice that you're having trouble staying on the ball, talk to the doctor and see if there's anything that might be helpful. I haven't forgotten about the caregivers. They often wonder, well, how can I help? You want to exercise patience and be supportive. Those things are obvious. One of the things you can do is overtly ask how you can help. So that's a big one. Sometimes, they'll say, well, I don't know if I should fill in the blank because I don't want to make my family member angry. Well, you don't know if you're going to do that until you actually ask them, do you want me to help you when you're struggling with a word or when you can't remember something, or do you want your space and you want to figure it out on your own? You want to allow for extra time to complete tasks. Reduce distractions, so try not to have a conversation if the TV is on. Whenever I go see an inpatient, I ask to turn the TV off before I engage with them. Offer gentle reminders. The gentle is the important piece. You can also ask them to repeat information, which makes sure that A, they understood it, but it also helps them remember. And then using visible reminders can also help keep somebody on task. And finally, pick your battles, right? You can't win every one of them, so which ones are the ones that are most important? So in summary, MS can result in cognitive changes. It doesn't always. Adhering closely to your treatment recommendations is going to be really helpful. This is my #1 mantra: what's good for your body is good for your brain. That's the only magic bullet I got. So diet, exercise, mental health, all those things really matter. Compensatory strategies can help you function at your best. So if you are having some changes, that'll help. And finally, if you are still having problems despite addressing these things, talk to your doctor. See if you need an evaluation or some kind of intervention that might help. There's neuropsychology that can help, occupational therapy, speech therapy, as well as some other strategies that you guys can benefit from, all of which are represented at OSU. And much like that puzzle that you saw, we all work together to help make sure everybody here has the best outcome they possibly can. Thank you.